using. So in these kinds of situations, people do not just sit around waiting for the war to end and for help to come. They definitely step in to provide public services. And I think there's pretty well established literature that shows that in situations like that in the Eastern Congo, both donors, people coming, international institutions, multilateral and bilateral donors, as well as Congolese citizens and citizens of these fragile states very much want to build a strong democracy, but the so-called post-conflict state is predatory, weak, and corrupt. And so what I'm looking at in this study is the role of informal actors who have been doing these jobs of the state, things like providing services. And often these jobs of the states are done sometimes quite literally as the state looks on. So if we could look at the next slide. This is a photo from a plane crash that occurred in Goma in the Eastern Congo in 2007, photo by Lionel Healing. And I love this photo because I think it encapsulates very succinctly the problem that I'm interested in. So you see in the foreground, we have someone who is a firefighter who has the uniform, the helmet, the equipment of someone who is supposed to be doing this job. But he does not appear to be actively involved in actually fighting the fire that resulted from this plane that failed to take off at the Goma airport and landed in the market that's right next to the airport. Instead, you have just ordinary people using whatever they have at hand, finding water and trying to save people and put out the flames. And so, the state, it's not that the state is not present in this situation of extreme fragility in Eastern Congo, but it is the case that the state is not high capacity or not very functional. And in many ways, you see all kinds of situations across a wide variety of governance sectors where this same kind of thing is going on. So let's go to the next slide. And I think there are 7 points. So maybe we could just go through all of those. There is a very large body of literature on informal institutions in DRC. I'm not going to go through it all right now, but it is well established that these informal institutions are active in all kinds of areas. So just kind of basic governance, providing law and order, dispute adjudication, that kind of thing. The education sector, I've done some work there along with many others. The judicial sector, the American Bar Association, some other organizations trying to specifically fight the problem of sexual and gender-based violence in that context, health, security, and patronage networks, all of these different kinds of institutions. And I think it is very important to understand that they are very different kinds of institutions. And so the basis for comparison is a little shaky sometimes, but these institutions are acting as governance actors. And we see that even rebels, even kind of the bad guys, the people who are wreaking havoc, often do provide public goods, not just in Congo, but in kind of similar fragile state situations around the world to build support for their mission. And when their mission is independence, Stuart has shown pretty convincingly in a recent piece that that this is what's going on, that they are basically exchanging public goods for support, for loyalty in the interest of creating a state. So let's go to the next slide. So likewise, the literature on reconstructing states, there's a big literature on this, and I don't have time to go through all of it. But we know a lot about sort of economic recovery and what helps. It turns out that the push that donors tend to make towards democratization actually has a tendency to backfire and to create instability, including instability in the economic sectors. And so it ultimately slows down economic recovery. I think the students in the class for today read Desha Gerard's 2012 article on the non-strategic desperation hypothesis, or sort of where governments are getting their resources, and particularly whether they have natural resources that they can draw on, can very much determine the success or failure of a state reconstruction effort. And we know that in the past decade or so, donors have become a lot more selective in how they think about this. And part of that selectivity is because they often just don't know how post-conflict governments are spending money. But I would argue that in the bulk of the literature, there's a real problem still and a real gap that needs to be filled, and that all of these theories are still very state-centric. They're thinking about the state as the primary engine, the primary actor, engaged in the project of state reconstruction. Of course, it's very reasonable. I mean, we're talking about state reconstruction. But what's actually going on in these countries is not nothing. There's not anything missing below the level of state. So let's go to the next slide. And I think a major mistake that a lot of donors make is that there is this kind of assumption running through a whole lot of donor literature and proposals and that kind of thing for projects, that there is this post-conflict institutional void. And that basically, because the state is not functional or the state has low capacity, that means that nothing else is going on. And so they also have a tendency to see the state as the solution. So Severino Teixeira has written quite well about this in a 2011, thinking about like the state is the only option. And so the programs that donors design, that NGOs implement, that they get funding for, tend to be addressed or aimed at building state capacity, or reconstructing the authority of, kind of local governing authorities, or rebuilding the rule of law, which, I think you need a magic wand to do that with a donor-supported program. But very few of these programs tend to account for the fact that there's all this other stuff going on below the surface, and that informal institutions of governance either pre-existed prior to the collapse of the state, or were created during the period of state decline. So next slide. So what I spend a very large portion of this manuscript trying to do is first just to explain what's actually there. So who's providing the services? Where does legitimate authority come from? Think a lot about James Scott's concept of legible and illegible institutions. Some of these things are more visible than others. So you have churches play a very, very prominent role in governing the Eastern Congo in the state's absence or weakness. Patronage networks, kind of the big man model, where there's somebody who's wealthy, whether through inheritance, or these days it's more likely they're active in smuggling, mineral trade, that kind of thing. You have business alliances that will sometimes work with ethnic group leaders, that kind of thing. And all of these institutions are quite active and quite busy trying to keep their societies ordered and managed in ways that very much look like governance. And so some of the literature refers to this as real governance. Real governance in the Eastern Congo. Informal governance is another term you might find. And I think Tateka and DeHert really well have described this when they talk about the situation in the Congo as being one of a series of sort of hybrid and negotiated institutions. So where you have the lines between what's public and what's private are very much blurred, and everything is always up for negotiation. So the sector that they're looking at in this particular article that I referenced, which, sorry, I didn't put the year, I think it's 2011, they talk about the education sector and sort of things like how are school fees decided upon in public schools in the Eastern Congo. And the first thing you have to understand about public schools in the Eastern Congo is that they are not run by the state. Their management has essentially been contracted out to non-state actors, usually the churches. And so there is a process of negotiation that goes on between the church, between the school officials, between state actors who may still be in place, even if they don't necessarily have any authority or power, between the parents who are going to have to pay the tuition, and sometimes, particularly in the secondary schools, with the students themselves, and what they and their families are going to accept. So what this means is that informal institutions are very rarely static. And so studying them, getting a sort of analytical grasp on them can be a little bit of a challenge. Let's go to the next slide. So this is one example. This is a public hospital in the city of Goma, run by a church that's called the Troisième CBCA, which is a Baptist church that has its roots a little bit further north in the North Kivu province. And so the stuff at the top, the ECC, the 3, the CBCA thing, the logo with the cross and Alpha and Omega, those are the markings of the church. But if you look below that, where it says Zone de Santé Hôpital Général de Référence, this is an official state hospital. This is part of the state's healthcare provision system. So it is part of the health zone, the urban health zone of Kirisimbi, which is the northern side of Goma. And it is the general reference hospital known as Virunga. So that means that there's a system of referrals. You're sort of supposed to go to your local clinic first, and then if your problem is more serious than what the nurse there can handle, you go to a bigger clinic, and then maybe you go to a hospital. This is the place you come to if you're really sick and nobody else can help you in that zone. And it is both a public and a private institution at the same time. And that means that things like the cost of services, the pay that doctors and nurses and other healthcare providers and administrators receive, what patients have to pay in order to be allowed to check out and leave, is always up for negotiation at all times. So let's move ahead to the next slide. So the heart of my project, as I've already kind of mentioned, is basically what explains the varying outcomes in efforts to strengthen the Congolese state. So let's say that a donor like the World Bank or the European Union comes in and decides to give a large donation to improve public health in Congo. And let's say that hospital that I just showed you a picture of benefits from that decision to distribute funds, to train healthcare providers, to provide medication and other supplies that are needed. What explains why some of those efforts work and others don't? And almost all of these efforts are framed as state reconstruction. And the hypothesis that I try to test in the manuscript is that successful state reconstruction occurs when aid workers take into account and incorporate these negotiated hybrid governance structures. In other words, when they work with the informal actors, rather than saying, no, we can only focus on the state is the legitimate entity here, the state is the thing that we need to strengthen, things don't necessarily work. It's when they work with the actors who are already getting stuff done, who are already, in a sense, governing, that this is what successfully reconstructs the state. So this study, next slide, please. Are we on the method slide now? Great. So the study is based on over 200 key informant interviews conducted between 2005 and 2016 in 5 cities in the eastern Congo. Those cities are Bukavu, Goma, Butembo, Bunia, and Beni. And unfortunately, especially in the early period of this study, it was not possible to do the kind of systematic research in rural areas. So this is a study of urban areas, and that's a constraint. And observation and site visits between that same time period. And so what I was doing through this was collecting data on capacity, examining performance indicators, examining like usage rates, as well as trying to capture the perspectives of both formal and informal governance actors in the region. I'm happy to talk more about that if you'd like in the Q&A. So next slide. And I'm looking at this across 4 sectors. And the 4 sectors were primarily selected because they can be studied. That's kind of a major issue in Eastern Congo. There are things you would like to look at, but that are kind of hidden away. But these were 4 sectors where it's possible to observe and possible to get people to talk to you about these issues. So healthcare, education, security, and infrastructure. And you can see there on the slide the ways that they vary. So in healthcare, donors have kind of fully accounted for and incorporated informal institutions into their efforts. Education, you have a partial incorporation. Security, you have very little to no incorporation. And infrastructure, there's none. So next slide. And this one, I think, sorry, I didn't quite get the points right on that, but it should have, I think, 2 things. If you click twice, everything will come up eventually. And thank you. So to kind of quickly go through a whole lot of data in a way that hopefully makes a little bit of sense. I thought I'd talk a little bit about 2 of these in more detail and 2 of them in less detail, but I'm happy to answer questions about all of it in the Q&A. So the healthcare sector. The healthcare sector in Congo is contracted out for the most part to religious institutions, just like the schools are contracted out to religious institutions. And what this means is that the big umbrella church organizations in the Congo. So the Catholic Church, and then there is an umbrella organization of Protestant churches. There's an umbrella organization of the Muslim community, the Islamic community, and then the Kimbanguish Church, which is a local religion that has a couple million adherents still. And these four groups have agreements with the state, essentially to take over or contribute to the public healthcare system in much the way that the picture I showed you a couple of minutes ago that church does. So the agreements that they sign are known as the conventions, it's a contract, and it assigns different responsibilities to the state and to the non-state actor. So non-state actors are responsible for like the day-to-day management of the facility, for sort of finding and proposing who should be staff, for continuing education of staff, that kind of thing. And the state is supposed to be responsible for paying the salaries of healthcare workers and administrators, for actually like signing off on the hiring and firing of personnel, and like owning land, paying for its upkeep, and paying for the maintenance of facilities. Those are the state's responsibilities. The state does not do any of that anywhere. And so what has evolved over time is a hybrid and negotiated system whereby local healthcare providers in Eastern Congo and throughout the country have developed other means of gaining revenue and trying to keep their hospitals and clinics and other facilities going to sort of best practices, high standards, using modern medical techniques. So in most cases, this involves a fee-for-service arrangement. People will be charged a fee when they come in. This should be free under the arrangement with the state. The state should be paying for services, or the state should determine what fees are if there are going to be fees, but that's not how it works. So the churches essentially decide on fees, and they use those fees to pay personnel. They use those fees to try to maintain facilities and to do all of the things that a hospital has to do. But this, of course, is very, very difficult. Most Congolese are extremely low income. And so this is usually insufficient. And healthcare organizations often try to partner with NGOs. NGOs are often looking to partner with them. So that's a positive. But there is a huge visible difference in a Congolese hospital that has support from NGOs versus those that are just trying to survive on fees for services themselves. But that's kind of the basic arrangement. In terms of thinking about big projects towards state reconstruction, so prior to the mid-2000s, about 2005, 2006 is when this program gets underway. These arrangements had really been mostly ad hoc. It would be like Doctors Without Borders, shows up in Bunia when the war is really bad, and people are killing each other, and it's a very, very dire situation. And they come into the local hospital and say, hey, we have supplies and trained doctors and medications and are able to work under really challenging conditions. Can we work with you? And they'll move forward on that arrangement, while the crisis is active. And then maybe they'll stay, maybe they won't. Or you'll have another, Médecins du Monde is another NGO. They might come in and say, we have some money from our donors to provide an HIV testing clinic. So can we open an HIV testing clinic at the University Hospital in Bukavu? And Bukavu says yes. These arrangements tend to not be very systematic. However, the European Union, through the creation of something called the Ninth Fund, or the Neuvième Fund, as they say in Congo, was designed to be a much more strategic and comprehensive approach to improving healthcare outcomes in Congo and improving the healthcare system in Congo. And so what the European Union did basically was provide subsidies to the healthcare providers, and particularly to the churches. And these subsidies were intended to kind of even out and build capacity across the board. So whether a hospital had previous cooperation with NGOs or not, it was going to get a lot of money to be able to pay personnel, motivate those people, right, to show up for work. I mean, a lot of the times doctors would run a private clinic or just flee the country altogether because they were paid so poorly and working so hard under such difficult conditions that it was very difficult to motivate people to come to work. A lot of money put into training, logistics issues, providing basic medications, supplies, but even things like motorcycles and ambulances and fuel for these things, laptops for record keepers and administrators. The range of services that the Ninth Fund made it possible for hospitals to have it was very, very comprehensive. And they did not set out to worry about whether it was with the state or not. So if there are some hospitals that are run exclusively by the state, they are very tragic and difficult places where there's just not any kind of resource and they're very poorly managed and going there is kind of a death sentence for most people. But there are other facilities that are relatively well run and that have maybe cultivated their own bases of independent donors, gotten attention. You have a couple of hospitals in the Eastern Congo that got a lot of attention because they work with survivors of sexual and gender-based violence, and ended up on Oprah. And so Oprah supporters sent a lot of money, and that made it possible for them to do more. But you have this incredible disparity. And the Ninth Fund just didn't care who they worked with. And so they were willing to work with non-state actors, even if that meant sort of not directing resources to, quote unquote, the state to get the work of healthcare provision done. And this effort has been a success. In the time, I'm not going to go all of the way into it, but in the time from just prior to the start of the program to 2014, there was a 30% reduction in child mortality. That's under 5 child mortality. And one of the things I trace in the manuscript is just this incredibly wide range of observable improvements in the condition of facilities, the drug stops, personnel, like people showing up for work, people being motivated and excited about their jobs, as well as building the capacity of state actors in these hospital facilities, which is something I'll talk about in a second. So let's go to the next slide. And I think there's 3 clicks to get everything up. Sorry, it's okay? All right, so the security sector, on the flip side of this, I think there are a lot of problems in the way that donors treat the problem of security in Congo and the way that they sort of conceive of what security means in the first place. But there has been, a highly state-centric focus, and this is understandable. No international organization is going to fund a non-state militia in the name of providing stability and security. There's a reason that they don't do this, but I think it's a good example of how avoiding informal actors, not all of whom are up to bad things, is necessarily the right way to go. So in the security sector, the international community tends to treat informal actors, and by informal actors, I mean rebels, as largely uniform. So they're all bad guys. They are all raping and looting and burning down villages. They are all, trying to secede or create their own little fiefdom or take over the state. And this is not actually the reality on the ground. There are a few, not many, but a few groups where people have just formed self-defense militias for their communities. If your state was not able to protect you from marauding gangs of bad people, you might gather the weapons you could find and get organized and set up a system of, texting each other on cell phones or using drums to send messages through the forest to defend yourselves and only use those capacities in true self-defense. But the international community does not look for a lot of nuance in the character and purposes of these groups. And so they see disarmament as the only solution. But when a group is disarmed, which is increasingly rare that anybody even is disarmed because the Congolese army is, again, corrupt and predatory and incompetent. But when there is disarmament, there's no protection provided for communities. So they might convince a group of people to put their weapons down, but then they're left vulnerable with no state actor there to protect them. And as I said, you know, the Congolese army has not had much success in disarming groups in the first place, or in trying to bring any kind of stability to the region. So this approach where we put hundreds of millions of dollars into this strengthening the state security services in Congo, into training different units of the army, into trying to get soldiers to march in straight lines and fire their weapons in the correct direction. It has not had the effect of bringing security to the Eastern Congo. And in fact, I think you could probably argue right now that things are actually worse than they were 15 years ago at the end of the supposed real conflict. The latest estimates by the folks who study this stuff is that there are over 150 armed groups just in the Eastern Congo. Now, some of these are insignificant. It's 10 guys with a grievance and some guns. But others of these are quite large, several thousand people, and are able to cause really considerable harm to civilians around them. And this is an aside, another project I have working on, I have students coding human rights abuses that have been committed by these security forces since these training programs began. And we think this is not published yet, so please don't put this on the internet. But we think that what we can show with our sort of preliminary results is that actually the effects of international efforts to train and professionalize the Congolese army have made them more effective at abusing the human rights of civilians, and particularly of human rights workers, journalists, civil society actors, anybody who kind of stands in opposition to the state. We can show a really strong correlation between like a unit being trained, say, by the American military or a European military, and it becoming a more effective fighting force, but it uses those skills to oppress people, not to improve the situation. So moving on to the next slide, I'm running low on time, so I don't want to spend too much time on these next two sectors. But do we have the education infrastructure now? Yep. Okay. So education, like I said, there's a partial accounting for informal institutions, and it's partial, and arrangements tend to be ad hoc, and so not surprisingly, we see some improvement in parts of the education sector, and no improvement or worsening in others. And I'm happy to talk more about this in the Q&A if you'd like, but for time, I'm just gonna go through this quickly. Infrastructure is my kind of weird outlying case. There is no accounting for informal institutions, and there are informal actors who do infrastructure work in Eastern Congo, nowhere near to the extent of these other sectors. But you do have like local business associations that try to maintain the roads in their areas, or cell phone companies that will actually pave roads, or try to keep, electric systems, try to help with keeping the electrical grid running because their system depends on the electrical grid working. So that does exist, but infrastructure has these kind of confounding variables in it, in that, you have the role of China and you have the government taking on these massive infrastructure projects, where it doesn't really seem to matter. It's not the international community coming in the same sense that like the World Bank is funding a donor-supported program, or the European Union is doing something like that. And so we do see some improvement in infrastructure despite this lack of accounting for informal institutions. The next slide, I have an example of that. This is two stretches of the same road in Beni, I think about 2010. And as you can see, the part that the Chinese had rebuilt at that point is in much better shape than the stretch of the road that had not had attention and was fairly terrifying, as the car I was riding in on that picture on the left did not have great brakes. So let's go to the next slide. So this is just a chart that kind of shows how the four cases shake out. I want to talk a little about what I think the causal mechanism is here, and how I've tried to tease that out. So we'll go on to the next slide. That's okay. So this is kind of the part of the manuscript I'm still working on, and I really appreciate your feedback if you have thoughts on this. But in the interviews and in my time in Eastern Congo, It's very, very clear that people who are providing services, informal governance actors, do not want to be doing this. They very much, it very much angers like healthcare officials that the state doesn't live up to its end of the bargain in the contracts that they have with the state. They don't want to be in this position of providing services without any support on behalf of the state. And they want the public employees, particularly the public employees who have been kind of overseeing them or who are supposed to be overseeing them, they want them to be able to effectively do their jobs. And so what we find in many of these cases is that a lot of the informal actors who have access to resources actually pay their regulators from the state so that they are able to do their jobs. So, for example, you might have like the district health commissioner in Goma, whose job it is to oversee all the health facilities in the district, which is usually 3 to 4 health zones, which would encompass the city, basically. And he will get a salary, or they actually call it a bonus. It can't be a salary because the state is supposed to pay the salary, so they call it a bonus, but it's a salary. He doesn't get a salary from the state to this doctor, so that he can go out and examine and oversee and regulate the health facilities that are run by the non-state actor that's paying his salary. And they're drawing this out of their own budgets. Obviously, that does not make for a very effective regulatory regime. But a lot of these actors are not looking to cut corners. They're not looking to sort of skirt around regulations or get away with stuff. And they actually do want effective governance. They do want effective oversight and regulation. And so they're trying to build that even when they don't have funding. But when major donors come in, these informal actors almost uniformly across the board insisted to the European Union, to other donors, that they wrap the public employees in. So they didn't just want it to be about, we're going to make this hospital bigger, or we're going to make this school better. We're gonna improve the quality of service here. They also wanted them to include regulation. And so a lot of the arrangements that ultimately get made provide for that, provide for making it possible for the district health commissioner to go out and inspect his hospitals on his regular schedule, and to have a motorcycle and fuel that he can do that with, to have access to the record keeping tools, laptops, software, et cetera, that the hospital employees also have. And so what this does is, I think it creates a virtuous cycle where you sort of have public employees who are being pulled into the system, whose capacity is also being built, and who are in turn, kind of building up their institutions and making sure that the people they oversee are better trained and better able to do their jobs. And so it kind of turns into the system where public employees and informal actors are continuing to reproduce their behavior as their capacity grows. And so paradoxically, by focusing on the informal actors, the non-state actors, this has an effect of donors actually strengthening the state without having to directly address the state. So it's a virtuous circle argument that I'm making. And we'll go to the next slide. Almost done. So I think there are several questions and avenues for further research. Whether the system of informal governance in DRC needs fixing is something I get asked a lot of the time. And I think that the answer is yes. But people don't support just let's hand over everything to the state right now, because everybody knows that would be a disaster. And it's illogical for citizens to pay taxes to the state when they know they're not going to get anything in return. They're not going to get any public goods. It's better for them to hang on to their money, pay an informal actor for a service, and their kid gets healed. But it's also dangerous to have this sort of indefinite period of lots of actors governing while nobody really has legitimacy and nobody really has true authority. And so people don't want that either. They do want a functioning government. They do want functioning services, and they see that in neighboring states. Something that's become really striking to me in recent years is how much more now than a decade ago Congolese would point to Rwanda as an example of better governance, which, if you know anything about Rwanda, it's authoritarian governance. but they're not wrong, right? The public services in Rwanda are much better than public services in Congo. And I think that, when you think about what's really at stake here, something like good enough healthcare is better than nothing for sure, but in the long term, it's not as good healthcare, and what people deserve. So that's a question, and then a few others. The next slide, please. There are questions about authority and legitimacy, that play in, and control, and who gets to make decisions, and participation and accountability. So there's some projects on things like community-driven development, community-driven reconstruction. Can you get people to trust in their local authorities better if you help them build a bridge? And a lot of those programs are showing null results. They're showing that no, people don't trust their local authorities anymore. They still trust the people who actually govern and actually get stuff done. And I think there's a ton of opportunity here. If you're a grad student looking for a topic, how and whether we can change people's notions about authority and legitimacy in these kind of hybrid negotiated systems, I think are huge and fascinating questions that need a lot of creative thinking. Next slide really quickly. I think there's a need for further research to figure out what these local institutions are. So what are these informal institutions? Who really holds power? The illegible institutions like that Scott talks about. How do we find out about them? What if nobody wants to tell us? It's none of our business. Maybe it's not our business to find out about them. But can we, in some cases, collect data on these? And how do we deal with the fact that like I said, with the security sector, many attempts at state strengthening are in fact actually reproducing and strengthening a predatory state, which is also not good for people. So if this is something that you're interested in, I'd be happy to talk further about it. There's a ton of questions that are unanswered here, and that my book is not going to be able to answer. But with that, we'll go to the last slide, and I'm happy to take your questions. Thanks for listening.